Okay, hi everybody. In this lecture, we're going to talk about two main things. First of all, we're going to talk about the surface anatomy of the upper limb, and second of all, we're going to go over the skeletal anatomy of the upper limb. When we're talking about surface anatomy, we're going over it because people refer to the upper limb in different ways, and it's really important to have a standardized way to talk about it. So we'll go over that really quickly. It's pretty simple, and there are just a few landmarks that you might not have heard of. So first of all, the upper limb actually starts with the pectoral muscles. Okay, so there's a pair of them, but when we're talking about one half of the muscle, we're talking about one half of the pectoral girdle. So this region right here, if you follow my mouse, right here, that actually refers to one half of the pectoral girdle. Just to the right or lateral to the pectoral girdle is another region. Before we hit the deltoid, which is the shoulder, before we hit that region, there's a triangle that forms right here if you follow my mouse, okay? That region is called the clavipectoral triangle, okay? And that's an important landmark if you're considering, some surgical applications or whatever. But just know that that triangle is bordered by the deltoid, the clavicle, which is the bone at the top here, your collarbone, and your pectoral muscle. Okay, so there's a clavipectoral triangle. Just lateral to the clavipectoral triangle, you have the deltoids, or it's the big muscle that gives the shoulder its shape here. So that's the deltoid. And moving inferior to the deltoid is your armpit, which is commonly referred to as the armpit. In anatomical terms, we don't refer to it as an armpit, we call it the axillary region. Okay, so these regions here are called the axillary regions. Okay, so moving on, we'll talk about the arm and the forearm together because they're pretty simple. There's an anterior forearm, there's an anterior forearm here, there's an anterior arm here, and if we flip it around, flip around our specimen, there's a posterior arm here, and a posterior forearm here. So those are pretty straightforward. Those should come easily to you. Okay. Now, when we're talking about the elbow, a lot of people goof this up because they think the elbow refers to both sides of this joint, but that's not true. When you're talking about the elbow, you're talking about a posterior landmark. That is only posterior. Okay. The cubital region is the anterior part. Okay. The anterior part of the elbow is called the cubital region, and that is important to know. So moving on now, just distal to the forearm, you have the wrists, okay? And distal to the wrists, you have the palmar regions. The palmar regions, they have a few different features to them. You have palmar creases here, which are the lines in your hands. Those are referred to as palmar creases. And you have the thenar eminence, which is this muscular protrusion here, the thenar eminence. Okay, and further distal to the palmar regions, you have the digits or the phalanges. Okay, so you have the digits here, and they just refer to the fingers. Okay, so that's a quick overview of the surface anatomy. And all right, let's move on now to skeletal anatomy of the upper limb. All right, let's continue our discussion now about the skeletal system of the upper limbs. So we'll get started by talking about the scapula, which is the shoulder blade, and we touched on this a little bit when we were talking about the back, but let's go over it in a little bit more detail now. The shoulder blade combined with the collarbone give basically the major attachment points for the upper limb. That's why we're talking about them. There are three borders of the scapula. It's a medial border right here, lateral border right here, and a superior border right here. Okay, so those three borders make up this triangular bone. This little part that juts out is called the spine of the scapula. Not to be confused with the spine of the body, it's just the spine of the scapula. Okay, it's just that part that juts out. When it juts out, the spine becomes this process right here, and that is called the acromonion. Okay, so that acromonion is a major attachment point for the glenohumeral joint, which is the joint between the humerus and the scapula. And there's a cavitation in between right here. As you can see, there's kind of like a hole. That cavitation is called the glenoid fossa. Okay, right above the glenoid fossa is this little, I guess like a thumb-like projection, and that is called the coracoid process. And the coracoid process is just, it's there because it has an attachment point for some of the muscles and tendons of the body. So that's why it's there. Just remember that it's on the anterior and superior aspect of the glenoid fossa. Okay? So moving on now, with the clavicle, there's different parts of the clavicle. The most distal part and the closest to the glenohumeral joint is referred to as the acromion end of the clavicle. Okay? And when you get closer to the medial aspect of the clavicle, it attaches to the sternum in this joint in between, which is known as a sternoclavicular joint. Okay. One important thing about the clavicle is that it is not straight. Okay. Right now it looks like it's straight, but let me show you something. It's an S shape actually. Okay. So just remember that your clavicle is not a straight bone. Moving on now. We'll talk about the humerus. The humerus is the longest bone in the upper arm, okay, and it has several different parts to it. First of all, there's the shaft of the humerus, which makes up the long axis, okay, and there are different grooves in between. Now, unfortunately, this model doesn't have grooves that I can click and show you, but just remember that the first groove is right here, okay, and that's called the deltoid tuberosity, and that's probably the biggest groove of the humerus. It's called the deltoid tuberosity. Superior to that, there's two little outpouchings of the humerus. First is right here. That's called the greater tubercle, and right next to it, this little outpouching is called the lesser tubercle. Those are pretty simple to remember, just based on their size, okay. Now, as we get more distal with the humerus, there are different parts of it as we get closer to the elbow and cubital regions. This little projection out here is known as the medial epicondyle, and this little hole in between, this indentation, is known as a coronoid fossa. Okay, and of course, as you get to the lateral part of the same structure, is known as lateral epicondyle. There are two ridges in this epicondylar region. There is a lateral supraepicondylar ridge, which is right here, and there's a medial supraepicondylar ridge, which is on the medial side right here. And those are just important sites for attachment. Moving on down, below the humerus, there are two bones of the forearm. They're the ulna and the radius, okay? And the ulna actually makes up most of the structural integrity of the forearm. So the reason for that is because it actually makes up part of the elbow. This structure right here is known as the olecranon, and that's the part that actually makes up the functional unit of the elbow, which you can feel. So that's part of your ulna. Okay, so that's why the ulna gives a lot of structural integrity. Okay. Now the radius is right next to it, and the radius can articulate around the ulna by rotation, external, internal rotation. So the muscles around it actually twist and turn as well. Moving down, there are 8 cubital bones, and we'll go through each one individually, but instead of clicking on each individual bone, I'm just going to tell you what they are, okay? And I encourage you to go look it up, or just maybe I'll attach like an image to this lecture so that you can actually see what it is. Because I've tried clicking on it each time, and each time what happens is the zoom screws up on this website, and I have a hard time clicking through 8 individual bones, and it's sort of disorientating for everyone. So instead of doing that, I'll just name each individual bone, and I'll tell you a mnemonic, which will help you remember them, okay? So moving from the medial part of these 8 bones, I'm gonna go in a pattern, like I guess you can say counterclockwise, and that'll give you the names which coincide with this mnemonic. The mnemonic goes like this: she likes to play, try to catch her. I'll say it again: she likes to play, try to catch her. Okay, and what those stand for are scaphoid lunate triniquium, pisiform trapezoid, trapezium, capitate, and hamate. Okay, so those stand for she likes to play, try to catch her. I'll say it again. Scaphoid, lunate, triniquium, pisiform, trapezoid, trapezium, capitate, and hamate. Okay, so just remember those 8 bones that make up the carpals. Okay, so moving on from that, we have the metacarpals. Okay, the metacarpals are just 1 through 5. They're named from the thumb going towards the little finger. So your thumb is 1, metacarpal 1, and so on. Okay. After the metacarpals, you have the phalanxes. Okay, so you have the proximal phalanx of hand 1. Remember, proximal means closest to the body. There are 3 phalanxes of the hand. Okay, so this is just proximal. After proximal, you have middle phalanx. So these are called the middle phalanx. And finally, you have distal phalanxes. Okay, and they're each named with each individual finger. Okay, so you have proximal phalanx and distal phalanx. Just remember that obviously for the thumb there's only 2. All right. Okay, so that's the skeletal anatomy of the upper limb. In the next segment, we're going to go through musculature.